Hello everyone, and welcome to this Ask the Expert webinar on health information privacy. I'm Megan Hiltner with the Healthy Start Epic Center. We have approximately 60 minutes set aside for this Ask the Expert webinar. It's being recorded, and the recording along with the transcript and slides will be posted to the Epic Center's website following the webinar. That website is healthystartepic.org. We really want your participation, and we've included some polls in this webinar. But at any point, if you have questions or comment, please chat them into the chat box at the lower left corner of your screen. We also want your feedback following the event, so please take a moment right after the webinar and complete the survey that will pop up on your screen. This webinar evolved from questions and comments that we received from TA requests or technical assistance requests and through discussions at regional meetings. And during the webinar, you're going to hear more about HIPAA provisions and data security requirements as they relate to Healthy Start programs. We'll also get into data sharing and really look at, for example, how you manage client referrals with regard to HIPAA and dig deep into privacy notice. This webinar is specifically for grantees that aren't located at an FQHC or a health department. If you are located at an FQHC or a health department, you can consult your office for HIPAA training. So let me introduce your speaker for today. The presenter is Ms. Patty DiPadova. She's a senior consultant at JSI and has been providing HIPAA training across the country through JSI's work with community health centers and other healthcare providers. I want to let you know, Patty definitely knows her stuff. She is not a lawyer though. She will not be answering any legal questions, but I guarantee you, again, she does know this content area. So before we get started, we want to do a really quick knowledge check. So if you'll take a moment and respond to this knowledge check question to the best of your ability. So I'm going to read the question, and the poll is showing up on your screen there. HIPAA only applies to covered entities which include A, health plans, B, healthcare providers, C, healthcare clearinghouses, or D, all of the above. So what do you think is the correct answer there? I'll give you a moment to respond. And by doing that, you just click on the radio button next to the responses. I see about 8 of you have responded. I'll give it one more minute here. Okay. All right. Looks like everybody thought the answer was D. So we're going to do one more knowledge check question, and then we're going to go through the presentation, and at the end of the presentation we're going to ask you these questions again and see if any of your responses have changed. So then the next question we have here is, and there's a few abbreviations here, but I'm going to read the question out loud. Which of the following is required to be included in a privacy notice by a covered entity? Is it A, a list of providers that the protected health information, or PHI, could be shared with? Is it B, a copy of the entire HIPAA legal document? Or is it C, how the covered entity may use and disclose protected health information? What do you think? I see people are chiming in. And give it one more second here. Okay, and it looks like everybody thinks it's C, how the covered entity may use and disclose protected health information. I'm not going to give away the answer just yet, but we will be getting more into Patty will be covering this content in her presentation. So listen close and see if your answers change by the end of this. So I'm turning it over now to Patty to begin our presentation. Patty?
Hi everybody, thanks for joining us. I just wanted to give you an idea of what the objectives are, and just to state, first of all, this is just a broad overview of HIPAA. It's kind of just a taste. You may be aware of a lot of the things we're going to talk about, or some of them might be new. But to really delve into the requirements of HIPAA, it would take probably a day-long session as a minimum, plus the time you would need to develop policies, procedures, and other documents. So this is really a high-level overview, and the objectives are really to build an awareness of not just HIPAA, but also privacy and civil rights law, of which HIPAA is one of those. and to explain patient privacy requirements and guiding principles, and to be able to describe the responsibility of a covered entity. Next slide. So the main takeaways, and I can't really emphasize this enough, is the very first one is use your common sense. Treat your information, or treat people's information the way you would want other people to handle your health information. And I just want to go a little deeper into that. There are some issues where people use HIPAA or not a firm understanding of HIPAA to actually keep information from being shared that would benefit someone's health care or someone's services. So it's really, really important not to overdo it with HIPAA or any of the other privacy requirements, but just to meet the standards that are set up. And then the other takeaways are just we're going to talk about some policies and procedures, not all of them, and some of the documentation that's required to comply. Next slide. So as I said, HIPAA is a subset of privacy and civil rights laws, and it's really important to be aware of all of the ones that could impact the work that you do and the state that you're in. The federal laws include HIPAA, and that's what we're going to talk about most in this webinar, so I'm not going to define it here, but we'll spend the rest of the webinar talking about HIPAA. But you also need to be aware of the confidentiality of alcohol and drug abuse patient records. It's often referred to as Part 2 because it comes from 42 CFR Part 2. It's similar to HIPAA, but it's slightly different. There's some overlap. Also, other federal laws that can apply are the Title II of the Americans with Disabilities Act, or ADA. And in terms of educational records, the Family Educational Rights and Privacy Act, or FERPA. This is not a conclusive list. It's, again, just touching on some of the bigger laws that are out there. And there may be others that may impact the work that you do as well. Some of the state laws that can be in place, and again, it's different from state to state. So it's important to know where you're operating, what those requirements are. Very common ones are doctor-patient and therapist-patient privileges, communicable disease reporting to public health entities, and there could be specific laws relating to minors in terms of some of the work that you may do. So it's important to be aware of those. And we are not going to go in depth with any of those laws. So, but I just want you to be aware that they're out there and they can impact the work that you do. And in some states, the state law may supersede HIPAA even. And HIPAA may supersede the state law. Usually it depends on which law protects the individual's privacy the most, and that would be the law that would be in effect for the particular issue. Next slide. So we have another poll. How comfortable do you feel about HIPAA as it relates to your work? First choice is extremely comfortable, and somewhat comfortable, or I don't know anything about it.
So folks, if you'll take a moment and chime in, yeah. It will really give Patty some understanding of how in-depth to go on some of this stuff. And I see folks have chimed in. Looks like a mix here. Yeah.
Great. Okay, next slide. So the HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. There are 5 main rules that comprise HIPAA. The first one, and the one that people think of the most when they're talking about HIPAA, is the privacy rule. It was the privacy rule established national standards to protect individuals' medical records and other personal health information, which we also call PHI. This is the rule that most people refer to when they're talking about HIPAA, and it's the one we're going to be concentrating on throughout this training. The second rule that went into place was the HIPAA security rule. And that's the one that's really talking about those safeguards, like administrative, physical, and technical safeguards to ensure confidentiality, and also the integrity and security of electronic protected health information. The third rule that went in place was the one that established national identification numbers or identifiers, and they're called NPIs, and you've probably heard of those. Providers each have a unique NPI number that they carry with them throughout their career, which is different than the way it used to be, where they would have a number for each health insurance that they would take, different numbers for their licensure, and those can all change over time or from state to state, whereas the NPI follows them throughout their career and from one state to another so that their work can be tracked. The fourth rule is that for the transaction and code sets, and that established standard transactions for electronic data interchange of healthcare data and adopted standardized codes for diagnoses and procedures. The fifth rule, and we'll touch on a little as well, is enforcement. These are the civil and criminal penalties that may be assessed to ensure that HIPAA rules are followed and that organizations are in compliance. There's the source at the bottom would give you a lot more information about each of these specific rules. Again, we're going to really concentrate on the first one, privacy. Next slide. And next slide. So the HIPAA privacy rule sets standards for when personal health information can be shared by establishing permitted uses and disclosures. The most important terms to understand are covered entities, the covered entities business associates, and protected health information, or PHI. That's because the HIPAA privacy rule only pertains to covered entities and business associates, and then the way they use or disclose protected health information in their care. Next slide. So covered entities are in three categories. This was some question at the beginning of the poll. They're either health plans, healthcare providers, or healthcare clearinghouses. Next slide. A health plan that is a covered entity is pretty basic. It's commercial health insurers or managed care organizations or government insurers like Medicaid, Medicare, and the VA Administration or Veterans Health. Next slide. Providers are a little bit of a different definition than we might normally think of them. This is a legal definition. A provider is either a person or an organization. So clearly a hospital would also be a provider, or a whole clinic that a provider works in. And some of your agencies may also fall under this category. They may or may not. But a healthcare provider is a person or an organization that furnishes, bills, or is paid for healthcare in the normal course of business. And the important thing, the and, is they also transmit health information in electronic form. I think it's important to note that if you're a covered entity that is a healthcare provider and you fall under this definition, that even though the definition says transmits health information in electronic form, it will then pertain to all health information, including the written word, verbal information. But this definition is just to qualify who is a healthcare provider and who is not. It's possible that there could be a healthcare provider, a physician, a physician's assistant, nurse practitioner, who might be working in some kind of a category in the United States where they're not doing this. They're not furnishing, billing, or paying for healthcare in the normal course of business and not transmitting electronic health information. In that case, then they wouldn't be considered covered by HIPAA. Even though they are a healthcare provider, they would not meet this definition. An example might be someone who is a nurse practitioner working in a church parish and not billing for anything, providing free care and not transmitting information electronically, having a paper chart. So that would be someone who's not a covered entity because they don't meet this very prescribed definition of a healthcare provider. Next slide. So healthcare clearinghouses are basically big data organizations. So the best example is a billing service that processes data in a standardized billing format. Next slide. So if you're curious about whether or not you're a covered entity, and the Healthy Start Grantees in many cases may be very directly a covered entity, and in some cases it might be clear that you're not. But there might be a lot of gray areas. If that's the case, it's really worthwhile to get on. There's a tool here that there's a link here to a tool through CMS that walks you through all the questions to ask to decide whether or not you're a covered entity. Again, I would go back to one of the first slides to use common sense. Even if you're not a covered entity, you're going to want to treat people's protected health information the way you'd want your health information treated. The difference is, and we'll get into that a little further, is covered entities are required to jump through a lot of hoops. So if you're not a covered entity, you really should know that because you wouldn't have those requirements. But if you are a covered entity, you want to be in compliance. So it's a good idea to get on the site. And if this isn't clearly defined for you, the next step might be to consult an attorney who might help you figure out whether you need to comply. Next slide. So we have another poll. Have you ever used the Covered Entity Guidance Tool, the one we just discussed?
So if you've seen it before, folks, or looked into something like this before, let us know. We were curious. It looks like, Patty, most folks have not seen it yet, so it might be worth you all taking a look at.
Definitely. It's definitely worth checking out. Even if you don't actually use the tool, it might be worth taking a look at the questions and start thinking about that within your organization. So the next definition that's really important to understand in terms of HIPAA is a business associate. So a business associate is not a covered entity, but it's an organization or a person that might support a covered entity by performing functions or activity that involve the use or disclosure of protected health information. So they're working for the covered entity or contracted with the covered entity and may either come in contact with protected health information or actually be responsible for doing something with protected health information. So the examples that were given here are someone doing data entry on behalf of a Healthy Start worker, assuming, again, that Healthy Start program has determined that it's a covered entity. If they're not a covered entity, then that person would not be a business associate. Or an enrollment specialist that's enrolling participant in the health insurance plan. Again, only if they're providing those enrollment services for a covered entity. So it's kind of a branch of a covered entity. There has to be a covered entity in order for the business associate to exist. Next slide. So covered entities needs to be really clear. I'm sorry, not the covered entity. The business associate has to satisfy a number of things. in order for the covered entity to make sure they're compliant with HIPAA. So the covered entity has to get assurances from the business associate or BA that they will use the information only for the purposes for which it was engaged by the covered entity, that they'll safeguard the information from misuse, and that they'll help the covered entity comply with their part of the HIPAA privacy rule. Next slide. So the best way to do that is through a business associate agreement, because the covered entity has to get the satisfactory assurances in writing, and that's best done through a contract. The business associate agreement can be an addendum to existing contracts. So if you're working with a transcription service, for example, and they already have a contract, the business associate agreement could be a few pages that are just added on to the end of the contract. It doesn't need to be a separate document. But the business associate agreement, or BAA, describes the permitted and required uses of protected health information by the business associate. Sorry, there's some duplicate words in here, but and also requires the business associate to use appropriate safeguards to prevent a use or disclosure of protected health information other than the way it's supposed to be used according to the business associate agreement. So basically, the covered entity is saying, I'm contracting with you. You're going to either handle or have access to protected health information, and I need you to assure me that you are going to comply with all HIPAA compliance regulations, just like I would have to as a covered entity. There's a sample business associate agreement. There's a link to it at the bottom of this slide. I would advise you to look at it. It's very well written, and it has some places where it suggests where you might want to modify it to customize it to your organization. They're pretty simple to pull together. Next slide. So what's protected health information, or PHI? It's information that's either created or it's received by a covered entity. It relates to the past, present, or future physical or mental health or condition, or it relates to the provision or payment of health care of an individual. And it's identifiable. It identifies the information, the individual, or there's a reasonable basis to believe that the information can be used to identify an individual. Next slide. So this slide, you don't really need to know everything on here, again, unless you're a covered entity or a business associate. But these 18 different factors have to be considered in terms of de-identifying protected health information. So just because you leave someone's name off something doesn't mean that it's not still protected health information. In fact, for the second one, the geographic subdivision smaller than a state, you can only use the first 3 digits of a zip code. You can't use the whole zip code. And if you have those 3 digits and all the people that live there are less than 20,000 people in the first 3 digits of a zip code, you can't even use that. So you have to be really careful that you're complying with these specific factors. For the third one, there's an asterisk there about all elements of dates. Dates can be used. However, and those are things like birth dates, admission dates, discharge dates, and dates of death. However, if the person is age 89 or over, you can only use a year. You can't use a month and a day. So it's to make sure we're not putting things in such small population categories that someone could be identified. So I won't go into each of these. You'll have the slides if you need to take a look at them. But it's really important to be aware of the types of things that can identify someone and not just be thinking of their name and address, those kinds of things. Next slide. So how do we, what are the permitted uses and disclosures for a covered entity or for a business associate? The first one's pretty obvious. You can give the information to the individual that it's about. It's their information. If they want their information, then they are certainly able to receive it. The other big one is for treatment payment or operations. If you are functioning as a healthcare provider, a clearinghouse, or a health plan, then anything that has to do with taking care of a person's health, mental health or physical health, that involves treatment payment or operation of a clinic or a facility organization, if those things are necessary for that, then that is a permitted use. This is frequently an area that people misinterpret. They think HIPAA means they can't ever give out information. It can really impact someone's health if these uses and disclosures are not considered. So, for example, if someone sees, and I'm not going to be able to get a great Healthy Start example here because I'm not sure which of you may be covered entities, but excuse me. If a primary care provider excuse me, refers someone to a cardiologist, they don't need to get an authorization to send out the referral and any health information, including a complete medical record, to the cardiologist because that's part of treatment. And they can also give that information to health plans. They wouldn't give any more information than is needed. But if the referral requires an approval, a prior approval from the health plan, they may need all of that. Or if they're doing some quality improvement initiatives in their organization and they need to be able to see that data, that's okay as well. So these are the things that do not require an authorization specifically from the individual for whom the PHI is for. The third thing is clearly if there is a valid authorization, that's a permitted use and disclosure. The fourth one is one I do some work with emergency preparedness, and this comes up frequently with that, and it would also come up with hospitals. It is okay to have a facility directory available that can be shared with a relative or close friend or other person identified by the individual. So for an example, a hospital can have a directory of who is an inpatient. A shelter that is a healthcare shelter or healthcare proxy, something that was set up in an emergency situation, can also have a facility directory. The important thing to note is that if someone does not want to be on that directory, they have a right to withhold that information. But the onus is on them to make sure that they've told the organization they don't want their name on the directory. And that may come up in cases of abuse or where people do not want their location identified. But without them making that determination and notifying the organization, it is a permitted use and disclosure without an authorization. And then the last one is just kind of a catch-all, where uses and disclosures don't require consent. Excuse me. And that may be some local laws, or there may be some very specific things. And some of those will come up on the next slide. Next slide. So when consent is not required, the first one is to avert a serious threat to health or safety. This is something that came up in Katrina, where sometimes data was needed. Pharmacies needed to be able to get prescriptions to people, and there was this, it was not possible to make sure they could get consent. Information was needed to be shared amongst organizations and to avert a serious threat in an extreme situation. So, there are times when it's just not going to happen, where people's health is much more important and their safety is more important, and you have to deal with those situations first. Second, as required by law, and there may be some specific laws where consent would not be required. For public health activities, so validations of infections, coming in and doing some TB work where there may be situations where there's tuberculosis going through the community. So those types of public health activities. Coroners, medical examiners, and funeral directors, organ donation, and then some specialized government functions such as military and veterans activities. And then the last one is for workers' compensation. Next slide. Okay, now we're going to talk about the requirements if you are a covered entity. And I can't stress that enough. If you're not a HIPAA covered entity, these are not requirements that you have to comply with. But you should try to figure out if you are. So this is, again, a long laundry list. This will be part of a much deeper, longer training. We're not going to go into all of it, but if you're a covered entity, this is kind of the laundry list of what you need to do. We've talked about the business associate agreement, which is the third one down, to amend contracts that you have with your business associates to make sure you've included those provisions. And we're going to talk about the last one, develop and disseminate a privacy notice. But you'll notice there are a lot of things here that require policies and procedures to be put in place regarding medical records and being able to track medical records, to see who's gotten into a medical record at any point of the day, and stamp that by time and date and who it was, and giving individuals the right to inspect and amend their records. There are a lot of procedures and policies that would be required. But again, if you're not a covered entity, they're not required. And we are going to really be talking now just about the privacy notice. That's the big time-consuming requirement. So next slide. So the privacy notice. What needs to be in a privacy notice? You've all signed these, I can tell you now. You sign them not only with your healthcare providers, but banks. They give you a privacy notice, usually annually. And your healthcare providers give you one when usually your first visit, and then often every visit just to make sure you've gotten it, or at least annually. So what needs to be in it? Basically, how the covered entity may use and disclose protected health information. So there are ways that the covered entity may use and disclose protected health information if they inform you in advance. Marketing is one of the major things that can be in that. It usually is not. But it's a good idea to, if you are a covered entity, to look at all the ways you might in the future, even if it's not now, but in the future, think you may need to use or disclose protected health information. The privacy notice would also include individual rights with respect to the protected health information, how they should make complaints, and what the covered entity's legal duties are with respect to protected health information, and contact information so that if they have other questions or to get further information about the covered entity's privacy policies, and also the effective date. If the covered entity decides to make any revisions to their privacy notice, they need to redistribute that privacy notice to everyone involved and make sure that it's posted appropriately. The law regarding the content is listed here if you wanted to take a look at it for more detail. Next slide. There's a great website on hhs.gov. It's listed here with kind of the picture of it that has model privacy notices. They're in different types of formats so they can meet whatever needs an organization may have. There's a booklet, there's a layered notice, there's a full page notice, and then there's one that's text only. There's instructions for covered entities in terms of crafting their privacy notice and making sure it's customized to their organization. And the model notices are available in both English and Spanish. So this link would give you access to all of those model notices. Next slide. So here we have another poll question. Do you have a sample privacy notice that you'd be willing to share with other grantees? Yes or no? If you could all answer that, we could take a look.
Looking like the majority of the group does not have one that they
Okay.
have, so that website might be an important resource if you're looking for a template.
Might even be just worth looking at, even if you're not a covered entity, to kind of, it doesn't hurt sometimes to look at the specifics of, make sure that you kind of have this thought process with your organization to make sure you're protecting things the way you think it should be protected. So how does a privacy notice get distributed? For covered entities with a direct treatment relationship, it should be distributed with the first encounter. This is from the law, so it does say patients, and I know that you have clients or participants, so you can substitute that word in, but this is coming directly from the law. So the first encounter would be the first point of distribution. It should also be made available electronically through either a patient portal or another electronic service. Through prompt mail or telephone service. It should be posted at all service delivery sites, posted on the website. It should be available to anyone who asks for it, whether or not they are a participant in your program. So if somebody walks in off the street, you need to have it available. And I'm sorry, I think my computer is rebooting. So I'm going to ask you to keep going ahead, and I'm going to go from my notes.
Sounds good. That's what we're here for, Patty.
Yeah, all the patches just uploaded to my computer. And so, and you need to make a good faith effort to have acknowledgement that the person who got the privacy notice actually received it. A lot of organizations will have a spot where people have to sign that they received the privacy notice, whether or not they want to take it with them. I know I rarely take it with me. So the next thing we're going to talk about is the business associate agreement. We talked about it a little bit. Again, I think some of this is duplicative. So I think we're going to move ahead. Looks like 2 slides were in there twice. We're going to move ahead to slide 34, enforcement. And this is the part I said I was just going to touch on a little bit. There's a lot more information, and you can see it on the sources that are listed for HIPAA compliance, but there are non-compliance penalties. HIPAA is very serious business. Again, no one wants their private information to be available to people that they don't want to see it. So there are financial and criminal penalties for noncompliance. The penalties can be applied even if there is not a breach of protected health information, but there's not compliance. So the most common one for that is having no business associate agreement in place, which is one reason we're really talking a lot about privacy notices and business associate agreements. So if you don't have a business associate agreement in place, but you didn't even have a breach of protected health information, you're still not in compliance. And ignorance of HIPAA rules is not an excuse for a rule violation. Okay, next slide. It should say breach responsibilities at the top. If there is a breach, it's really important to conduct a breach risk assessment. And then once the risk assessment is conducted, it's important to notify the impacted individuals. So a breach risk assessment involves examining the nature and extent of the protected health information that was involved in the breach, including the types of identifiers and the likelihood that someone would be re-identified. And also checking to see who the unauthorized person or persons were who used or could see the protected health information, whether the protected health information was actually acquired or viewed, or there was just a risk that it might have been, and the extent to which the protected health information risk has been mitigated. So all of those things added together would be the breach risk assessment. So then it's up to the covered entity to notify without unreasonable delay the affected individuals, or they need to show that they do not need to notify the affected individuals because the risk assessment showed that they may comply with some exceptions to the rules. So one exception would be if two people in an organization who both were HIPAA trained worked on potentially different projects and mistakenly someone saw something on someone's desk that they shouldn't have seen. They told them they shouldn't have seen that, but they both, were HIPAA compliant in every other category. That would be an exception. That wouldn't be a breach that would need to be reported. It's interesting, though. I live in New Hampshire, and I looked on my state's records for breaches because they have to be reported publicly. And some of the breaches in my small state involved 50,000 people or more at a time. So breaches can be significant because of the nature of electronic data. So those are really, any breach needs to have a risk assessment and followed up, and individuals need to be contacted. But you really do need to do that risk assessment to get an idea of really how big the damages are. So I'm now on slide 37. It starts with remember. So remember, protected health information can be disclosed for treatment, payment, and operations to prevent an imminent threat to health or safety, and for identification, location, and notification. It's really important not to forget that because there have been a number of cases. There was a recent issue of the Journal of the American Medical Association, I believe it was in June or July, that had 3 articles discussing this topic and about how some people are not getting the appropriate health care because people are too worried about HIPAA. And they're not following HIPAA standards. They're going even further. And it's not what the law was meant to do. It wasn't meant to deprive people of health care. It was meant to keep their information safe. So it's really important not to overstep the law. I had a good example where I was trying to make an appointment for one of my adult children with their doctor, and they wouldn't let me make the appointment. And I had to remind them I was providing them with information. They weren't providing me with any information. So it can really kind of go too far sometimes. So it's really important to just follow the law and not try to go way beyond it. But in all circumstances where you're unsure, try to get consent when you can. Limit the protected health information provided to the minimum necessary to get the job done. And make sure you have the policies and procedures in place that are required by law, particularly if you're a covered entity or a business associate. That's the end of kind of my formal slides. I'd like to open it up for questions now.
So Patty, there were a couple of questions that were submitted, and the first one, it goes into the slide where you were defining covered entities and you were defining healthcare providers. So the question is, do Healthy Start case management services count as being paid for healthcare in the normal course of business?
Again, I think you need to get on. I'm not a lawyer, and I don't work with Healthy Start grantees exclusively. I've done a little work with Healthy Start grantees. So I think you really have to look at what types of services you're providing, whether you meet the definition of being a provider, a healthcare provider. And the best way to do that is to get on and use that tool. If you use the tool and you still can't decide, it really is worth having an expert, a lawyer, give you some advice.
And that tool, folks, we put it into the chat box, but it's the CMS tool. We can reach at it if you want it. Let us know. Oh, there it is. Okay, so then the second question, Patty, and I remember in our planning for this call, we kind of discussed this. So you may not have the answer, but I'm going to put it out there in case other folks have the same question. It's about the slide where you were going into the de-identifiers, where you had the list, and I can pull that slide up while we're talking about it. Where is that? Over back here. Here it is. The person said this list reaffirms concerns about submitting our client level data to the Healthy Start monitoring and evaluation database. That it's been said that the information is quote unquote de-identified, but it contains a lot of these identifiers you list here. And so this group, this is Val, I hope you're okay with me putting your name out there. This is Valerie Garrison in Rochester, said that they've developed a revised consent form that really explicitly notes that they'll be able to, they will be submitting client level data. So it's more of a comment, but anything else you want to share on that?
You know, I think that's always a safe thing to do. Clearly, when you have a consent form, it's fine. You can provide the information. I do think you need to also look and realize that you need to look at what that relationship is, and if it's being provided for public health information to a governmental body, it may also be an exception. And also you need to look at, just because it has these characteristics, if you're not a covered entity, it's not protected health information. So it really goes back to figuring out whether you're a covered entity or not. So for example, if I went to Weight Watchers, they'd have a lot of information about me. They'd have my weight. They might have asked me if I'm on any medications. They'd have my name. They have my address. They'd have all kinds of things that I might consider protected health information. But they're not a covered entity. So it's not covered under HIPAA. So you really have to go back to that first question of whether or not you're a covered entity.
All right, thank you. That's great. That's great. Any more questions, folks? There's no more questions or comments in the chat box right now, Patty. So we'll kind of give it a moment.
Sure.
Maybe while we're giving it a moment, let's go back to our knowledge check and see if anybody's questions or responses have changed. So the question again, folks, is HIPAA only applies to covered entities which include A, health plans, B, healthcare providers, C, healthcare clearinghouses, or D, all of the above. What do you think? I'll just click in on the radio button. Looks like folks are figuring that out quick. Okay, and people's answers didn't change. And that is the correct answer. It is all of the above. All right, so then the second question here is, let me find the full note so I can read it to you. Okay, which one of the following is required to be included in a privacy notice by a covered entity? Is it A, a list of providers the protected health information, or PHI, could be shared with, a copy of the entire HIPAA legal document, or how the covered entity may use and disclose the protected health information? So if you'll respond to this one. And it looks like one person thought it was a provider list that could, the protected information could be shared with. The answer is actually C, or the last one, how the covered entity may use and disclose the protected health information. So go ahead, Patty.
Just to go back to the last question, where they talked about having getting consent up front to release the data to HRSA. The other thing that might be considered is to include that in your privacy notice. If you can have a privacy notice even if you're not a covered entity. There's nothing keeping you from complying with HIPAA even if you're not a covered entity. You're just not required to. So if you put together a privacy notice and it was in that notice that that's one of the ways that you're using and disclosing their information, then that would be appropriate as well. And then they would just sign that they received that privacy notice.
And Val just said, good idea, Patty. So thank you for sharing that thought.
Good.
And then another question did come in. If we aren't a covered entity, but we do have a business associate agreement with one, that is protected. Is that protected under HIPAA?
Yes. Then everything goes into place. So a business associate, however, doesn't have to have all the same things in place that a covered entity does. For example, if a participant may not still have the right to modify their record, which is one of the provisions that a covered entity would have. So you need to look at your business associate agreement and see what the covered entity has described specifically that you need to do, because that agreement should have a lot of detail in it as to how they expect you to treat the protected health information. So for example, if you have a business associate agreement to actually take over the care of an individual, they're probably going to include in there that you do have to have all the things in place that a covered entity would have. But if you're just doing a small piece for them and it's care management and they want that covered under HIPAA, then they would specifically state how they wanted you to use or disclose that data.
Well, so there's no other questions in the chat box right now, Patty. As I give these reminders about our next steps and upcoming activities, if you have any more questions, chat them in. We have a few moments. So there's a webinar coming up on October 9th from 3 to 4 p.m. Eastern Time. It's an Ask the Expert webinar. It's on the 4th trimester, a new paradigm for preventing maternal mortality. And that's with Dr. Haywood Brown. He is the immediate past president of ACOG, so he'll be presenting on that webinar. And then we have a series of various kind of discussion groups and opportunities for you to get engaged with some of your peers that are serving in the same role. And if this isn't your role and you just know somebody on your team that is either a certified lactation counselor or a fatherhood or meal involvement coordinator, feel free to share this with them. The second round of discussion group for both these, the CLCs and the fatherhood or meal involvement coordinators, are happening in October. One on October 11th for the CLCs from 1 to 2:30. Sorry for it seems like the webinar platform duplicates some of these numbers. So it's 1 to 2:30 Eastern, and then the male involvement coordinator fatherhood discussion group is happening on October 16th, and then the third one for that one is November 20th from 1 to 2:30 p.m. Eastern Time. If you're interested in either looping in or getting registered for those, you can just email the Healthy Start inbox and we'll get you connected with the right people. This webinar, the slides and the resources that Patty shared and the recording will be posted to our website following the webinar, and the transcript, and that will all be posted there. So check that out on the website. So there's no other questions waiting. I want to thank you, Patty, for taking the time to present on this webinar. And I also want to thank all of you for taking time out of your busy day to participate on the webinar and join in. If any other follow-up questions come up, feel free to send them our way, and we'll loop through with experts like Patty and try and get you an answer. This includes the webinar. Please take a moment and respond to the poll at the end or the survey to let us know your feedback. But this concludes the webinar, and I hope you have a nice rest of your afternoon.
Thank you very much.
Thank you.